My name is Haig Setrakian, a member of our Division of Pediatric Emergency Medicine and Point of Care Ultrasound here at Indiana University. In general, we'll reach for a high-frequency linear probe like the one shown here. This type of probe is optimized for viewing superficial structures with high resolution. We recommend that you hold the ultrasound probe so as to view the vessel in the transverse position. Avoid applying excessive pressure with the probe, which can inadvertently collapse your vein. We recommend that you start in the forearm as depicted here and gradually advance your search up the length of the arm to the brachial and basilic veins. Distal veins are relatively superficial. More proximal sites, while larger, sometimes are closely associated with more sensitive structures and are often slightly deeper. Here we can see a view of the veins at the level midway down the humerus. In this position, we have to be particularly mindful of the easily collapsible basilic vein, as well as the nerves that are closely associated with this vascular bundle. The cephalic vein may be very superficial. It is often visible superficial to the biceps muscle.
This is Frances Russell, and in this module we will go over point-of-care ultrasound of the lower extremity venous system. This will include pertinent anatomy and scanning technique.
For pure scanning, we will only scan the distal femoral vein in the lower thigh and the popliteal vein behind the knee.
And you'll want to start off just distal to the inguinal ligament, looking at the lower leg with the indicator towards the patient's right. So to assess the common femoral vein, again, you're just distal to the inguinal ligament, indicator towards the patient's right. And what you'll see here is the common femoral artery sitting out lateral. The vein is going to sit medially, so you'll see common femoral vein, and you'll also see greater saphenous vein. This is what it looks like on ultrasound. If you're scanning the patient's right leg, on ultrasound the veins are going to be more medial or on the right side of the screen. The arteries are going to be out more lateral or on the left side of the screen. Rotating into a long axis orientation, so now you have your indicator up towards the patient's head. So this is going to be towards the patient's head. This is going to be towards the patient's feet. You can see common femoral vein. You can see femoral vein, or what used to be called the superficial femoral vein. And you can also see deep femoral vein. You want to then rotate so your indicator is back towards the right and you're getting a short axis view of the patient's femoral vein and deep femoral vein. So this is what it'll look like on ultrasound. So here we have artery, you have femoral vein sitting here, deep femoral vein sitting deeper. You can tell that the arteries are going to be thicker walled, they're going to be pulsatile, whereas the veins are going to be thinner walled, they're going to easily compress with light compression. This is an example of light compression. Next, you go down and look at the popliteal vein. So you want to have the patient slightly abduct their leg and bend their knee, and they're also externally rotating at the hip. Here you're going to place the probe in the popliteal fossa, and what you'll see here is your popliteal vein and your popliteal artery. This is what it will look like on ultrasound. So the vein's always going to sit superficial or posterior to the artery, and the artery will sit down here. You want to make sure that you're above the trifurcation of the popliteal vessel so that you're actually looking at the popliteal vein and not a branch off of it. Again, you'll just use gentle compression to allow the vein to collapse, and you see that the lumen of the vein completely disappears. Again, the vein's going to be thin-walled. It's going to easily compress, whereas the artery is going to be thicker-walled, pulsatile, and take more pressure to try to compress it.